Medical news from Lancet, London, England. Cagrilintide-semaglutide, CagriSema, as an add-on to basal insulin in adults with type 2 diabetes, Reimagine 3, a randomized, double-blind, placebo-controlled, multicenter, phase 3 study. In a significant breakthrough for adults with type 2 diabetes, a once-weekly combination of cagrilintide and semaglutide, known as CagriSema, has been shown to improve glycaemic control when added to basal insulin, offering a promising new treatment option for those struggling with inadequate blood sugar management. This finding matters because it addresses a long-standing challenge in diabetes care, where basal insulin therapy often falls short in achieving optimal glucose levels, and is associated with unwanted side effects such as weight gain and hypoglycemia. The discovery of CagriSema's efficacy has the potential to transform the lives of millions of people worldwide living with type 2 diabetes. The burden of type 2 diabetes is substantial, with the disease affecting over 460 million people globally, and its prevalence expected to continue rising in the coming years. Despite the availability of various treatments, many individuals with type 2 diabetes struggle to achieve and maintain adequate glycaemic control, highlighting the need for innovative and effective therapeutic strategies. Previous research has demonstrated the benefits of combining different classes of glucose-lowering medications to improve outcomes in diabetes care, but there remains a significant knowledge gap regarding the optimal approach to intensifying therapy in patients already receiving basal insulin. This study was needed to investigate the potential of CagriSema as an add-on to basal insulin in adults with type 2 diabetes. The Reimagine 3 study was a randomized, double-blind, placebo-controlled, multi-center, phase 3 trial conducted at 46 centers across 6 countries, involving 274 adults with type 2 diabetes who were already receiving basal insulin therapy. Participants were randomly assigned to receive either CagriSema at doses of 2.4 mg each or 1 mg each, or a placebo, in addition to their existing basal insulin regimen. The study's methodology involved a parallel group design, with patients undergoing regular assessments of their glycaemic control, including measurements of glycated hemoglobin, HbA1c, a key indicator of blood sugar management. The primary endpoint of the study was the change in HbA1c levels from baseline to the end of the treatment period. The results of the study showed that CagriSema, at both doses, was associated with statistically significant and clinically relevant reductions in HbA1c levels compared to placebo. Specifically, the mean change in HbA1c from baseline to the end of the treatment period was significantly greater in the CagriSema groups compared to the placebo group. The study also reported favorable effects on body weight and rates of hypoglycemia, although the details of these findings are not fully elaborated. Notably, the efficacy of CagriSema was observed in patients with a range of baseline HbA1c levels, suggesting that this treatment may be beneficial for a broad spectrum of individuals with type 2 diabetes. In terms of secondary findings, subgroup analyses suggested that the benefits of CagriSema were consistent across different patient subgroups, including those with varying degrees of renal impairment and those receiving different types of basal insulin. These results are important because they provide reassurance that CagriSema can be safely and effectively used in a diverse range of patients with type 2 diabetes. The clinical significance of these findings is substantial, as they suggest that CagriSema may be a valuable addition to the treatment armamentarium for adults with type 2 diabetes who are not achieving adequate glycaemic control with basal insulin alone. The use of CagriSema in this context may help to reduce the risk of diabetes-related complications, such as cardiovascular disease, kidney damage, and vision loss, and may also improve patients' quality of life by reducing the burden of hypoglycemia and weight gain. As such, these results may have important implications for clinical practice guidelines and treatment algorithms for type 2 diabetes. However, it is essential to consider the limitations and caveats of the study, including the relatively short duration of the treatment period and the potential for adverse effects that may emerge with longer-term use of CagriSema. Further research is needed to fully elucidate the safety and efficacy profile of this novel treatment and to determine its optimal place in the management of type 2 diabetes. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.